Hi, everyone, and welcome to today's webinar, The Hidden Costs of Patient Intake Errors. I'm Stephanie Churchill, the Manager of Demand Generation and Marketing Operations here at Interlace Health. And on behalf of Interlace Health, thank you so much for joining us. Before we begin, I'm going to walk through a few quick housekeeping instructions. This webinar is being recorded, and registrants will receive the recording via email. All participants will be muted to minimize disruptions during the presentation. This webinar is meant to be interactive. We will start today's webinar with a presentation, and we'll have time at the end for a question and answer session. You can submit questions at any point in the questions box you see on your screen. Now let's meet our presenters. Desiree is the Director of Product Marketing at Interlace Health. She has 20 years of experience in driving strategic marketing initiatives, leading teams, and developing integrated campaigns. Responsible for sales enablement and training, as well as public-facing educational presentations, Desiree is a natural public speaker who enjoys speaking to large audiences in person or digitally. Anne is a solution architect at Interlace Health. She provides expertise to healthcare organizations wishing to incorporate Interlace solution services and integrated technologies to optimize patient, provider, and staff workflows. She relies on her experience in healthcare IT, including over 20 years in a variety of roles at Meditech, to provide tailored solution demonstrations, define scope, and align technical requirements during the sales cycle. Now with that, I'll turn it over to you, Desiree and Anne.
Thanks, Stephanie. So quick overview of our agenda today, what we're going to be talking about. First, we're going to understand those true costs of patient intake errors and learn how easily you can integrate e-signature at registration at your organization. And then we'll do a live demo to see how a digital solution really sets that right first impression with your new patients. So before we jump in, I want to do a quick poll of the audience and see how many of you are using e-signature at registration today. So I'm going to hit launch here, and you should see the poll pop up on the screen. And if you can just click on yes or no, I'm going to watch the tally here and give it just a second or two more until we've got our full percent here, and then we'll close it out. Got about 50% who have voted, so if you haven't had a second yet, just take a quick sec to click on the screen there. And it looks like a good majority are using e-signature at registration today. So I think that's just a good level set for us to see how everyone is doing things at their org right now. All right, thanks for doing that. So first up, we're going to explore how patient preferences have changed rapidly over the last several years and how digital tools that used to be nice to haves are now necessities. So when the pandemic first began, healthcare changed almost overnight. You know, in an industry that had been so slow to adopt digital first tactics, technology was suddenly at the forefront of healthcare delivery. And as a result, patients' expectations have changed dramatically. They've been able to schedule appointments online more easily the last few years, check in on their phones from the comfort of their car, fill out forms remotely on any device on their schedule, you know, receive virtual care via telehealth services in ways they could not before. And they want this convenient and efficient healthcare to not only remain an option, but continue to get easier and more like what they experience with other industries. Health systems and hospitals will have to work quickly to continue to meet that demand. And really to manage the momentum. Patients and providers are now so comfortable with virtual care. They see the value that it provides them. But you have to, like I said, manage that momentum and continue to create other technologies that will support that. Health systems with easy to use technology and appealing interfaces are going to be more attractive to patients. So a few ways to meet some of those patient expectations is to meet your patients where they are, you know, on their phones, on their tablets, giving them digital options to sign forms in your facility, and in some cases at home. And ensure that those interactions with them are all mobile friendly. Deliver a more personalized patient experience, create those retail-like environments with those digital interactions, getting rid of paper as much as you can, and enhancing your telehealth offerings with adjacent solutions that really integrate with your EHR and strengthen your patient's overall experience. And really, it's more important than you think to have any digital options that you can for your patients, especially in those first interactions that they have with you when they're coming on as new patients. A survey of patients actually showed that 60% want to fill out forms digitally instead of with pen and paper. It's just easier, and it's what they're used to in a lot of other industries. 65% want to communicate with a healthcare provider through a safe and secure digital method like texting, email, the portal, etc. And the digital forms really just rounds that out for them. And then 57% of patients said that they would switch providers to find a better digital experience. And that really has a direct impact on your patient volumes. And that number could even be higher with millennials and younger. It's 65% who are willing to switch. And then an important statistic on the other end of the spectrum is less than 15% were not very interested in any digital method. So while there are some out there who are still okay with that status quo, with that stack of paper, it's clear that digital tools are critical to speak to the majority of your patients. So how can you start to meet some of these needs? We've talked about these a little bit already, and we've talked a lot over the last couple of years about opening your digital front door, but you need to ensure that you're building out your virtual toolbox for successful engagement and pass-through of those new digital doorways. All of these advancements in healthcare have the power to be transformative, but only if the digital solutions behind them are efficient and interoperable, which is some of what we're talking about today. You know, portals have been around for a while, but usage was always low. It was sort of like having that spare tire on your car. You knew it was there, but you didn't think about it that often because you didn't need it. But once you do need it, you're extremely grateful that it was there. And COVID sort of forced that spike in utilization and engagement with patients in their portals. Remote patient monitoring, wellness apps, virtual triage and screening tools, and asynchronous options like secure direct messaging have also come to the forefront at the start of the pandemic. So these tools have really helped pave the way for providers to maintain contact with their patients without seeing them in person. So then the question is, why are we still handing patients a clipboard with paper forms at registration when there are all these digital tools that we're providing them and that we know that they want? So I want to talk about, in those instances, there's over 40% of hospitals are still using paper at registration, what those hidden costs are and how quickly it adds up to maintain that outdated process. So the registration process is painful. A lot of data is being exchanged. Many health systems struggle with this important process when it's collected on paper. Patients are frustrated with slow registration times, and causing walkouts in some cases or prompting them to look for another provider, which can lead to lost revenue for the hospital. Over half of clinicians have reported always feeling burnout, with a leading cause coming from paperwork. And when you see that they can spend up to 7 minutes on average per paper form that you have to process, you can see why that causes such a burden, especially at times like these when hospitals are overwhelmed with patients. So let's talk about the problems and the costs with paper. So we've compiled average national costs for printing, scanning, and shredding at 15 cents per page. And registration page length can vary, but the national average is 5 pages for a registration packet. So you can see how that could quickly add up for every patient you're registering. And then additionally, paper consents can lead to a lot of errors. 12% of HIPAA violations in the last couple of years have involved paper records and the manual errors on those. So Interlace Health has our own ROI tool for going digital that's based on a couple different metrics: the cost of paper and the resource burden associated with a paper-based process. So I'm going to sort of talk through a few of these statistics that we use to determine the return on investment when someone goes digital. So first, I've talked about the 15 cents is the average national cost to print, and those average registration packets are 5 pages long. So we can calculate that each paper registration packet costs about 75 cents to execute. That's not the time, that's just the actual paper costs. And paper costs have actually been on the rise. Inflation is happening across the US, but paper has stayed relatively the same price for the last 15 years, and it is finally seeing an increase because everything is going up. And so that was on the lower end. We could gradually see these costs to get up closer to $1 depending on how things go in the future related to paper and toner costs. And then when it comes to staff time, nationally it's estimated that 7 minutes of time is dedicated to managing paper at registration. And the average cost to employ a staff member is $21.32 an hour. And that's in normal times. You know, the great resignation that's happened over the last couple of years, we know is gradually increasing costs of staff, especially if you're having to use temporary staff to help fill in some gaps. So it could be even higher than this. So how do we take that information in the last couple slides and determine the actual costs, these hidden costs of printing forms? So here's a sample of costs that we calculated for a large acute care hospital by plugging in their specific numbers using those stats on the previous slides. So based on annual registration numbers at this facility is 125,000 new registration packets per year. Their paper cost to produce those forms is $93,750. And then based on the hours spent managing paper packets and the average hourly rate, so just pushing those through the system, that adds up dramatically to $310,917 to just push that paper through. And that isn't even accounting for those errors that I talked about in those HIPAA issues when there are incorrect information entered on paper forms and staff then have to go back and track down the time. So that could almost double if you're having a significant amount of errors on your forms. So overall, this creates a return on investment or a cost savings of $404,667 just by eliminating paper at registration with your staff time and the paper. Those hidden costs that seem so small individually really do add up. And what most people don't realize is that those savings are significantly higher than the cost and time needed to implement a digital solution like e-signature at registration. So having your own numbers identified can make your budget ask for leadership for a new digital solution like e-signature at registration so much easier. And we have a dedicated team of account managers who are available to create these custom ROI analysis or cost saving analysis for your organization for really any of our solutions. So you could see what the value would be that it would make for you. So I'm going to throw up another poll question here, just like the last one. Would you like a cost assessment and ROI analysis for your organization? So you'll see that pop up on the screen here. You can click yes or no. I'll just wait a few seconds for everyone to complete that. Got about 45% who have voted. So if you haven't had a chance yet, go ahead and click on the answer that's applicable to you. And now go ahead and close that poll out. Thanks again for taking your time to do that. So I've talked a lot about the value, the benefits, the challenges that both patients and hospitals are facing related to paperwork and how all of those hidden costs add up. But now I want to turn it over to Ann Hill, who can walk through our solution in action and show you just how easy it is.
Great, thank you, Desiree. Let me just make myself the presenter here and share my screen. Thank you, Desiree. So just to give you a brief overview of our electronic signature solution in action. So Charles arrives for his appointment and the registration clerk starts his registration process in the EHR and seamlessly launches any necessary forms for him to sign based on underlying logic that's in place. Charles can review the forms on a patient-facing monitor, as you see here. And as he signs on the Topaz signature pad, he can watch his signature appear on the form in real time. And the registration clerk can then save that form and it automatically archives into his chart in the EHR. So as the clerk files that registration event in the EHR, they are prompted to launch e-signature documents. The prompt defaults to a virtual printer that sends a data feed to the Interlace Health server, where we use that data to figure out what forms are needed for the patient, generate them in the database, and automatically launch the capture client to collect those signatures. An additional print-on prompt could also appear if there are forms that are required to be printed for some reason, or even wristbands and labels, etc. So once that prompt is accepted, hold on one second here. Oh, give me 1 second. Oh, sorry, it had launched in my other window. So as you see here, 2 forms have been launched for my patient Charles here. I have an admission consent form and then a HIPAA form down here. So a couple things to notice here. Patient's demographic information is automatically defaulted onto the form. Whoops, sorry about that. Is automatically defaulted onto the form. So there is no need to attach those labels or even print out those labels where, most of the time you're not even using all of them and wasting some of that label stock. Also notice that there are barcodes included on the form, both a patient specific as well as a form specific barcode. And in the event that this form would need to be printed, the addition or inclusion of the barcodes on the form make it that much easier to scan the form back into the EHR. So eliminating the need for that, manual scanning. Registration clerk can, allow the patient to review the form on that patient-facing monitor. And once ready, he or she simply clicks into the signature field here to initiate that signature process. I have a Topaz device here. That Topaz device becomes lit up, signaling that it's ready to accept a signature. So I'll go ahead and sign. And once that signature is accepted, you'll see that a date and timestamp is automatically included with every signature that is applied to the form. The registration clerk can easily countersign using a self-sign functionality that applies a digital signature to the form, and that format of that digital signature is customizable by your organization. And then moving on to the HIPAA form, again, registration clerk can easily initiate that signature process. Patient signs on the Topaz device. And then once all requirements are met, registration clerk can simply click archive. And then could also use the done button. And then once those forms are completed, they are automatically archived to the patient's chart and available almost instantaneously, for the care team to review if necessary. And then the staff is brought right back into the EMR where they left off to continue registering additional patients. And that was a quick overview of our electronic signature solution at registration. Desiree, I will make you presenter again.
Great, thank you, Anne. All right, you should be able to see my screen here again with key takeaways as we round out the webinar today. So just a reminder, using e-signature during registration eliminates the need for paper forms altogether. You remove the chaos surrounding paper. No one's looking through drawers for the right forms, wondering if new copies of the updated forms were put into the file, or looking for the patient's forms that you swear you already pulled out for their appointment. Better yet, you no longer have paper forms to scan in, manually enter in, and shred when you're done. They're all automatically archived into the EHR, so you'll see a reduction in staff time and printing costs there. However, if you're in a downtime situation, something like that, and you do still need to print, as Anne showed, those barcodes are on there, so you have a quick scan back in after the fact. Your compliance team loves these security measures, and they can rest easy knowing that only the most up-to-date and approved forms are being used because you have that digital forms library that everyone in your organization can access. It really is a simple process for everyone involved, both staff and those patients. So how can we help you and where can you see us next? We have another live demo on e-signature registration and also e-consenting for other clinical circumstances on May 4th at 11 a.m. You can find us at Muse Inspire in Dallas, May 15th through 18th on the exhibit hall floor. We're also going to be doing a product showcase on e-signature registration with one of our customers, Steward Health System. And I see Brandy's on here today. Hey, Brandy. And then we're always having monthly webinars going on, and you can go to interlacehealth.com/resources to register for any of those. And at any time, you can reach out for a customized demo and ROI analysis. So I'm going to turn it back over to Stephanie. Thank you again, everyone, for joining today, and we're going to open it up for questions.
Thanks, Desiree. That was great insight on the cost of patient intake, and it was awesome to see our e-signature solution in action. So thank you both again, Desiree and Ann. We've received a few questions during the presentation that we'll begin to answer. Like I said in the beginning, please feel free to continue to ask them in the questions box on your screen. Okay, so the first one, this is an awesome question. I saw you used a Topaz device for e-signature. Do you have to use that, or can you use a mobile device to collect signatures with your solution?
I'll take that one, Desiree. Yeah, you did see me today use a signature pad to collect signatures, but it is not necessary. We do have the option to use tablets, mobile devices, etc., to collect signature. And I'll also just add to that the screenshot you saw with the secondary monitor and the Topaz device. It is not, that is not the mandatory setup. It is what we have seen works best for our customers who are using our electronic signature solution. And, with that secondary monitor makes for, in our opinion, the most ideal patient experience so that they can actually see the form as well as their signature being applied to the form in real time.
That's great. Thank you, Ann. So the second question we got is, how many signatures can you capture on a consent?
That's another great question. We support an unlimited number of signatures per form. So if you have a particular form where you need to maybe capture a patient signature, a witness signature, and some other types of signatures, we support multiple or unlimited signatures per form. And I'll add to that a little bit in that in addition to signature fields, we support, as you may have seen from that first form I pulled up, free text fields, check boxes, as well as the signature fields.
Okay, great. Another question here, do we design our own forms or do you design the forms for us?
So that is optional, really. So as part of implementation, we would typically take on that burden of designing the initial forms that you plan to go live with during implementation. And then past that point, the maintaining, editing, or creation of new forms, there are options there. If you feel, if your organization wants to retain control of that process, then we would train you on our form design tool, at which point, you could maintain and edit and create new forms on your own. Or we also have an option which we call managed form services, where we could take on that burden for you and moving forward, do all that maintaining and editing and creating for you.
Awesome. And it looks like our last question is, can you speak to the EHRs that your solution is able to integrate with?
Sure. We are EHR agnostic and really work with any EHR. We work with all of the major EHRs like Meditech, Cerner, Epic, etc. And really, I don't think we've ever been encountered with an EHR that we couldn't work with. So we really support them all.
That's awesome. Well, thank you for responding to those, Anne. We are just about at time. So thank you both, Desiree and Anne, again for an excellent presentation. We really appreciate everyone's time today, and we hope that you found this webinar to be valuable in learning more about patient intake. Thank you for spending some of your afternoon with us, and we hope you have a wonderful rest of the day.